Hi, and welcome to 10 Kids, 2 Docs, Parenting Insights from Pediatrician Moms. I'm Dr. Sylvia Bank.
And I'm Dr. Vivian Carlin. Welcome back.
Welcome back.
Today, we are going to be talking about autism, and we are joined by a special guest today, Dr. Julia Jackson, who is a practicing child psychiatrist, a physician who specializes in child psychiatry and sees and takes care of a number of patients with autism. So we are excited to have her join us and for her to tell us her stories and share her expertise with us.
Great, let's jump in.
Welcome to the 10 Kids, 2 Docs podcast. Seasoned pediatricians and longtime friends, Sylvia Bank and Vivian Carlin have counseled thousands of parents and are raising 4 and 6 kids, respectively. Join these doctor moms as they incorporate fun and their combined wisdom and experience to share parenting insights for anyone looking for practical and trustworthy guidance. Please note that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment from your doctor.
Dr. Jackson, why don't you tell us a little bit about yourself?
Yes, I'd be happy to. So my name is Julia Jackson. I'm a child and adolescent psychiatrist. I've been practicing for 24 years now. I am also retired Air Force. I retired from the Air Force after 25 years in 2022. I do see quite a bit of children with autism. And I think, a big part of that is during military service. How it works is child psychiatrists, there aren't very many, 8 to 10 to 12 at any given time in the Air Force. And we're located in a few, separate Air Force bases in the US and then a few overseas. And how it works in the military service is when families have children, dependents as they call them, who are diagnosed with autism or other significant disabilities that require multidisciplinary care, they'll move the entire family from where they're located anywhere in the world to the bases where child psychiatry and other subspecialties are located. And so I think because of that, there was a definite selection bias where 80+% of my caseload at any given time were autistic children. So yeah, and I learned over time how much I love that patient population, and I've just carried that forward even in my private practice, which I started about 3 years ago.
So one of the things that we like to share with our listeners on this podcast is our perspective both as practicing physicians and as parents.
Yes. So I'm married. We have 5 children together. They're all boys. So our youngest son, who's 17, he was diagnosed with autism. He's high functioning. So personally, I have experience with parenting a kiddo with autism, and of course, he has ADHD and social anxiety like they often do as well. And then, it was interesting for me because I'd, prior to learning about his diagnosis, had, like I mentioned earlier, several years experience treating kids with autism. So it was eye-opening to see, the parenting side as well. And I think it's made me, even better at understanding it. I think even just seeing it in your own children is more difficult. That's what I tell parents that to this day, that we're just not objective by and large with our kids. And I have said that for years. And then I fell into the same trap I was talking about. I didn't see it in him. I just, when it's your own kid, you see things differently. And so it really does, I think, highlight the importance of having those separate, outside objective medical professionals and therapists to help you, see things more clearly when it's your own children.
So why don't we start by kind of defining autism and talking about the scope of that diagnosis?
Yeah, so as you guys know, as pediatricians, it's a very complex diagnosis, and it's a spectrum. It's in the diagnostic Autism Spectrum Disorder, and so from very low functioning, I'll start with the spectrum, then I'll kind of go into what it means. On the very, lowest functioning end of the spectrum, you often see global developmental delays, intellectual disabilities. Most of the time, oftentimes they're nonverbal or minimally verbal, all the way up to the highest level of functioning where some never receive a diagnosis. They're just, kind of seen as just sort of quirky, usually highly intelligent, and have, and it's an old term, but sort of splinter skills, where it's almost like they have superpowers in their brain to think and perceive things in ways that typically developing individuals cannot. So definition of autism at the core of it, there has to be social delay. So that's number one, and that it's divided up into separate, categories of social skills or abilities. But I'll just summarize the main ones. So one would be nonverbal communication. So they might have difficulty maintaining or modulating eye contact throughout conversations. They tend to not use a whole lot of gestures or facial expressions to sort of modulate the conversation. And then there's reciprocal, language, how you back and forth conversations. Reciprocal communication tends to be delayed. So not necessarily following up on social prompts, or maybe they do, but it's very brief, 1 or 2 words, and then they carry on with what they're wanting to talk about or what they're doing. So you don't get that natural flow to the conversation. And then there's general understanding of relationships, friendships, how to create friendships, how to maintain friendships, or even just a general understanding of why, people engage in social constructs like marriage or romantic relationships. There's just sort of oftentimes can be, not always, again, it's a spectrum, but oftentimes there can be really just, a concrete, literal interpretation of things. So I give some examples later if you'd like. So that's your core. You have to have social delays.
No, I was going to say, I really like that because I think it's overwhelming for parents and even physicians. Autism is so broad, and the number of symptoms that we see associated with autism can be so different from one child to the next. So putting it in this a little bit more defined of that there has to be some kind of social delay. This is the core.
Yeah, and right. And it's confusing for families as well, because we do know that there's a heritability, a genetic heritability component. And so oftentimes, when there's an individual with autism, you can trace back, somewhere in the family tree, there's other individuals who have autism. And what we know is that when there is a family history of autism, different family members within that same family tree can have traits. So they can have traits of autism, but they don't have the full syndrome. And so you'll see and hear about, even in my own family, kids or even adults that might hyperfixate or have intense areas of interest, but they are very socially intact. There's no social delay, so that's not autism. But it does confuse folks because depending on what they hear about what autism is, they might think that they do in fact have it. And so in addition to the social delay, you also have to have a category that's called restricted repetitive behaviors. And you don't have to meet all criteria that, that's listed, but at least a couple. And different examples of that would be, adherence to specific routines or sameness. They will only eat out of a certain bowl or a certain spoon, and they have a lot of difficulty flexing with that. Rigid beliefs about, it could be anything, but, for example, like one example, a kiddo that would not do homework because it seemingly didn't have the word school in it. So, I do work at school. Why would I do work at home? And it's a rigidity that really rarely, in my experience, if ever flexes. And so oftentimes what you have to do is modify the environment around them, because you're not going to get a whole lot of flexibility generally with folks with autism. And then there's, what we're more familiar with are in the restricted repetitive behaviors category are stimming, spinning, walking on tiptoes. It could be hand flapping or kind of finger, gestures when they're excited, usually. Visual stimming, you can see commonly fascination with lights and movements. And it's really sort of a close visual inspection. You'll see them really holding up visual stimuli, within an inch or two of their eyes, or peering sideways at things. And so that kind of just is a really large overview of, the criteria. And you have to have both. I kind of, in my mind, have more of it's a spectrum. Are they on the lower functioning end of the spectrum? That would be the most severely affected kiddos. They oftentimes have intellectual disabilities, lots of delays. They're the most severely affected from a social delay perspective. And so again, sometimes they're not verbal at all. Or you might, or maybe some non-purposeful vocalizations. You might hear some scripting, phrases or clips from their favorite, shows or movies. They might kind of script them, but it's not purposeful in terms of they're not trying to communicate functionally with you, but they're kind of vocalizing this. Or you might hear the high-pitched squeals or just growling or just whatever sort of vocalizations that they gravitate toward. They do communicate, though, with the assistive communication devices. Even on the lowest functioning, they'll point to what they want and need, and they on those devices. They understand, they can be really severely affected, but if parents say it's time to go get your shoes or, whatever it is, they understand and will comply. And so I feel like a lot of the reason, this is my theory, a reason why they don't speak is because speaking is a social function. So while they understand language and they can point or communicate with you in their own way, I don't know if they really feel like there's a need or a point to verbal communication the way we do.
That makes sense. Could you kind of describe, well, first, like what are the parameters for considering a child high functioning autism? And then kind of describe from your own experience, both as a parent and as a provider, what does that look like in someone's home? Because we get a lot of questions of, oh, should I be concerned? Should I be concerned that my child has autism? Like, what are kind of things and different ways that it could present in your home? And we released an episode on ADHD, and I made a comment there that there isn't any story I could tell that typifies every child with ADHD. And there also isn't any story I could tell that hasn't happened to children that don't have ADHD, right? I think this is probably part of the problem, is that any stories we could tell about this could happen to many kids without autism, right? So this makes it very hard to try to give parents an idea of when they should be worried and when not. So put parameters, for us, some guidelines on what is high functioning autism, and then some ideas on how that presents in your home and when to be thinking about it.
Yeah, no, excellent question. And you got my wheels turning when you were speaking about that, so I'll start with, to answer your question, so high functioning autism, they typically, now again, I say typically because it's a spectrum, and just to your point, what I'm saying is not an absolute, so this is in general, but there's always exceptions where they're individuals just like the rest of us, and there's unique qualities, even though they may be similar on that area of the spectrum. They might present in uniquely different ways, and they probably will, actually. I've never seen two people with autism that are exactly the same. So I'm going to answer this with, that caveat in place. So high functioning autism, usually are very verbal. These are the ones, and they usually either have a significantly higher cognitive ability, or there's subsets within their cognitive ability. There's a splinter, like they're really advanced in visual spatial, or incredibly advanced in, like the artistic ability. So there can be splinter, skills, but they tend to be incredibly verbal. They're the ones that, parents will say we're talking in full sentences or in phrases at 15 to 18 months. And their ability to do their own activities of daily living is higher. They usually are, pretty good at taking, making food and getting dressed and getting to places, where they need to be. Again, these are generalities, and they do, have, I think, more verbal interaction with you. It might be one-sided, a lot of the time, where they're focusing really on their areas of interest and not necessarily a smooth back and forth, but they're more verbal than, on the lower functioning. So I think that the biggest difference for me, low versus high, is their cognitive ability, their verbal ability, and how much more independent are they on the spectrum. So lower functioning, they usually need 24/7 supervision for safety. It's a lot of supports. Higher functioning, they might be largely independent, and just need some supports in certain areas, maybe more complex social areas.
I think this probably brings out why there's also a big range for when kids are diagnosed, because if, as you described, a lot of kids that ultimately are diagnosed with autism are verbally maybe even advanced in these younger ages. And that causes them to slip through without us being able to make that diagnosis.
That's been a pattern I've seen. Yeah, that is a clear pattern I've seen over the years. And I don't see it written about, so this is it's my opinion based on years of clinical experience. But exactly what you said, the higher functioning kiddos tend to pass through their developmental milestones with no problem. And their social delay is subtle enough that you're not going to necessarily pick up on it even the parent, like in my case, the parent might not even pick up on it.
Mm-hmm.
And then in the, as you know, primary care visits tend to be significantly shorter than mental health visits, at least.
Sure.
And so you don't have the luxury of, spending an hour or two like I do, really observing and trying to interact with the kid and whatnot. And so it is much more subtle and hard to pick up. They tend to pass through all of their milestones. When it's not uncommon for me to pick up on the diagnosis when they're approaching middle school, during middle school, early high school timeframe. And they often come to see me for related conditions. So depression, anxiety, maybe some OCD sort of behaviors. And then when I see them, it's pretty clear to me, that there's also high functioning, usually it's high functioning at that point, autism. And that can be a shock to parents and to, a lot of folks. But
how does that present, that high functioning? What are the clues that you see, or maybe parents could pick up when you're suspicious of high functioning autism?
That's a good question. It's difficult to answer, but it's for me, it's a lot of pattern recognition. I don't even know how many kids and young adults I've seen over the years, definitely in the thousands, maybe tens or thousands or more. And so you get really good at differentiating what is typical development, what is typical language and, communication abilities per age, and what are the outliers. And so how it would present for me, if it's more obvious, you can hear the variations in their voice. They might be a little more robotic. There might be more of a sing-song quality to their language. Sometimes you can pick up on, it's called idiosyncratic, speech, where it's phrases that, aren't necessarily phrases we use commonly, but they might be using it pretty frequently. But, and if you don't have that, which sometimes you don't, sometimes, even their language sounds, there's no variation in their prosody or volume. Another, tip off would be, the eye contact is almost always poorly modulated, and it tricks you because they can sometimes look right at you and get really, it looks really good, but you have to look at the totality of the appointment. And over the totality of the appointment, you see that most of the time they're looking down or away or to the side of you. They usually are more stoic in appearance, less facial expression. You see me, I'm talking with my hands, and I'm they tend to be a little more stoic appearance, with their affect. And then another way it could present is the hyperfixations, the intense areas of interest that are not developmentally typical. And so, maybe a ninth grader who is very hyperfixated on Pokemon, that may not flag when they're 7, 8, 9 years old, but now they're 9th, 10th grade and they're wearing Pokemon clothes and backpacks, and that's what they want to talk about, and that's really what they bring the conversation back to. That can sort of be a tip off as well. But ultimately, I would say if parents are concerned, or to your question about when should they be concerned, the way that I look at that to answer that question is, one is the child bothered by how they're feeling or behaving or functioning? Are they having distress, signs of distress? And that can show up as either tearfulness, crying, or anxiety, worries, kind of perseverative worries, or it can show up as irritability and defiance that's out of character for them, but it's ongoing. Or the other area that I think can be indicative of something that should be seen, it would be reduced functioning. So that can be anything. They're not sleeping as well, they're not eating as well, their grades are dropping, they're isolating more at home, there's more fights in the home, more parent-child conflict that maybe wasn't there before. And so those, can be red flags that it's probably a good idea to have them seen and evaluated by a professional, because it's tricky. It's not easy to pick up, especially on the higher side of the spectrum.
Well, I just want to thank you, Dr. Jackson. This has been so helpful. For the sake of time, we are going to stop this discussion today, and I'm going to recommend to our listeners Please join us next week when Dr. Jackson is going to share with us more about her experience as a parent of a child with high functioning autism. And I want to just give a recap for our listeners of what we discussed today. So remember, autism diagnosis is a spectrum. We reviewed what typifies both ends of the autism spectrum. The autism diagnosis requires two things. It does require a deficit in social communication or social interaction, and a restricted, repetitive pattern of behavior, interests, or activities. No two children with autism are alike. They all present differently with unique individual traits. And children with higher functioning autism often have normal developmental milestones and are not diagnosed until much later in school age or even into adolescence. Dr. Jackson is a practicing child and adolescent psychiatrist, and we will include a link to her website in our show notes. And please join us next week as we delve into this even further.
Okay, this is 10 Kids, 2 Docs. I'm Dr. Sylvia Bank.
I'm Dr. Vivian Carlin.
I'm Dr. Julia Jackson.
We'll see you next time.
See you next time.
If you are concerned about your child's development or have concerns that your child may be exhibiting symptoms of autism, we encourage you to start with your primary care provider, who will be able to do developmental screening and refer you to further testing or resources as needed.
Thank you for listening to 10 Kids, 2 Docs, hosted and created by Sylvia Bank and Vivian Carlin. If you enjoyed this episode, please subscribe and recommend our podcast to other listeners. Visit our website at 10kids2docs.com, where you can find links to social media and leave comments or suggestions. Back next week with more topics in parenting.